Mobility is one of the most important functions for older people. The ability to be able to walk around your neighborhood, walk around your home is absolutely critical if you're going to remain independent, living in the community, if you're going to have a good quality of life. Yeah, in national surveys, when they ask people if they have difficulty walking a quarter mile, which is about 3 or 4 blocks, it's surprising that a very high percentage, as high as 30% of people 65 and older, say they do have difficulty walking that far. Most forms of disability, whether it be self-care or things like shopping, as well as mobility, we see higher prevalence rates in women than in men. And there are a number of reasons for this. It may be that women have conditions such as osteoarthritis and osteoporosis that lead to long-term functional problems, and they get at a higher rate than men. Also, women live longer than men, so they do live longer with their disabilities than men do. We're very interested in the effect that physical activity and exercise can have on helping people to remain mobile longer in their communities. So we have developed an intervention study called the LIFE study, Lifestyles, Intervention, and Independence for Elders, in which people participate in a exercise program that includes walking and aerobics, strength training, balance training, flexibility training, and we're comparing those people to people who are not getting those kinds of interventions and seeing how they have changed in terms of their lower extremity functioning, and hopefully in a study that we're doing now, we'll be able to demonstrate that the exercise interventions actually prevent the loss of ability to walk 400 meters, which is about a quarter of a mile. Yeah, there are a number of goals of a study like this. Certainly, if this study is successful, it will be important for older people and their families to know that even though people may be losing some functioning, that if they enter a physical activity or exercise program, they can actually either retain the function they have or perhaps even improve their level of functioning, and that these things are reversible. It'll also be very important for physicians to know that there is a proven intervention that they can literally prescribe to their patients as if it were a medication, that they can feel that there is good supporting evidence that this will work and prevent them from becoming disabled. While we're doing this big clinical trial to really prove once and for all that exercise is effective in preventing loss of mobility, there's enough supporting evidence that people now should really think about becoming more active, maintaining the level of activity that they have, and perhaps increasing their level of activity. So the most common form of exercise in older people is walking, and the best advice you can get is just get out the door and walk. And the more you do that, the better you will do in the long run.